Good morning, friends. Drug induced sleep endoscopy is a very important investigative tool for evaluation of the level of obstruction in a case of snoring. We'll take the patient into the operation theater, sedate him, and make him sleep so that he will snore. And now we'll pass a flexible laryngoscope through the nasal cavity into the nasopharynx, oropharynx to see the site of obstruction and whether it is anteroposterior collapse or lateral collapse. In this case, there is lateral collapse of the airways. Thanks for watching.